Dengue fever is transmitted via the bite of a mosquito harboring the dengue virus. Person-to-person transmission doesn't occur. However, a pregnant person with dengue can trusted source pass the disease to their child. Dengue fever symptoms. If you develop dengue fever, symptoms usually begin about 4 to 10 days trusted source after the initial infection. In many cases, symptoms will be mild. They may be mistaken for symptoms of the flu or another infection. Young children and people who've never experienced infection may have a milder illness than older children and adults. Common symptoms generally last for 2 to 7 days and can include trusted source. Sudden high fever up to 106 degrees Fahrenheit or 41 degrees Celsius. Severe headache. Swollen lymph glands. Severe joint and muscle pains. Skin rash appearing between 2 and 5 days after the initial fever. Symptoms of severe dengue can include belly pain and tenderness. Mild to severe vomiting 3 times in 24 hours. Mild bleeding from the nose or gums. Vomiting blood or blood and stool. Fatigue, restlessness, or irritability. Treating dengue fever. There's no medication trusted source or treatment specifically made for dengue infection. If you believe you may have dengue, you should use over-the-counter pain relievers to reduce your fever, headache, and joint pain. However, you should avoid aspirin and ibuprofen, as they can cause more bleeding. Your doctor will perform a medical exam, and you should rest and drink plenty of fluids. If you feel worse after the first 24 hours of illness, once your fever has gone down, you should be taken to the hospital as soon as possible to check for complications. How to prevent dengue fever? Avoid heavily populated residential areas. Use mosquito repellent indoors and outdoors. Wear long-sleeved shirts and pants tucked into socks. Use air conditioning instead of opening windows. Ensure that window and door screens are secure and that any holes are repaired. Use mosquito nets if sleeping areas aren't screened.